At Bryan Health, we care for patients, educate tomorrow's healthcare providers, motivate our community with fitness and health programs, and collaborate to continually improve how we serve others. That's why we are proud to present another Bryan Health podcast.
Welcome. This is the Bryan Health Podcast. I'm your host, Deborah Howell, and today we're discussing arthritis of the knee, something that becomes more prevalent as we age and engage in sports activities. Joining me is Dr. Brad Webb, a board-certified orthopedic surgeon, fellowship-trained in adult reconstruction and total joints in affiliation with Bryan Medical Center. Dr. Webb, what a pleasure to have you with us today.
No, I appreciate it. Thanks for having me on today. It's been a pleasure.
Great. Now, before we get into the nuts and bolts of treatment, can you tell us what knee osteoarthritis is?
Yes, knee osteoarthritis is really the breakdown, a little bit of wear and tear in the knee joint. All of our knees are covered in cartilage, which allows our knees to move and glide smoothly. Well, when that surface starts to wear down and break down, like anything over time, it starts to become painful. And that breakdown of the cartilage is what we refer to as osteoarthritis. So it's really kind of a wear and tear breakdown that has multiple factors related to it, but what we refer to as osteoarthritis.
More of the fun of aging, right?
Yep, that is correct.
And why is it so painful?
It's painful for a multitude of reasons. A lot of it is, though we refer to as osteoarthritis as more of a wear and tear, there is an inflammatory component, and our body releases a lot of painful inflammatory markers which cause pain, and that leads to a lot of the pain. It's also because when you get rid of this cushioning in our knee, we start to get more bone-on-bone wear, meaning the bones will articulate with each other and create friction and more swelling, and then also leads to more pain.
And who's most likely to get knee arthritis?
It's kind of all over the gamut. There's multiple factors. It is aging, individuals just through time, heavy labor jobs, as well as injuries, whether they were younger sport injuries or traumatic injuries. Kind of everybody is at a risk of developing osteoarthritis of the knee.
No one gets away.
No, we do not.
So what are the next steps once you find out you have knee arthritis?
The next steps of knee arthritis, especially really depending on kind of what stage you are by the time you finally get diagnosed, really a lot of it has to deal with kind of some non-operative managements. And some of the biggest things that are recommended through the literature and everything are starting what we say non-steroidal anti-inflammatory drugs like your ibuprofen, Aleve, and then there's some prescription ones as well. There's also what we talk to as activity modification, having your physician and therapist educate you about things, what to and what not to do. And then, if need be, there's other things like weight loss programs. There are injections in the knee. And so there's various different types of treatment options before you even get to what we always talk about and people hear is total joints and getting the joint replaced.
Can you tell us a little bit more about some of those various treatment options?
Yeah, and the treatment options really, it's pretty straightforward and simple. You kind of go down a path whether you're going in non-operative treatment form or an operative treatment form. And it's really based on what level is your arthritis and how much is it affecting your quality of life, as well as simple activities of daily living. And now we always like to start people in non-operative treatment, and a lot of that consists of activity modification, physical therapy, and or a series of possible injections, which may relate from steroid injections in the knee to other things that may help, which are related to as viscosupplementation.
That's a mouthful. Can you tell us a little bit about that?
Yes, and so though the literature's kind of been all over the place in terms of knee injections and their benefits, anecdotally we see it all the time. People get great relief, whether those injections may be steroid injections into the knee to help decrease some of the inflammation, which is the main driver of the pain and discomfort, or depending on the various stage of your osteoarthritis, viscosupplementation injections are what we refer to as hyaluronic acid injections. Sometimes the old terms people would call them rooster comb injections. Those are injected into the knee to kind of help create a little bit more of a fluid film, help decrease some of the friction, add just a little bit more padding into the knee to help decrease some of the pain and discomfort.
Sounds great. I'd love to know a little bit more about the team at Bryan Health.
So Bryan Health and our team of physicians have been working well to help develop a program that kind of makes our non-operative or even operative treatment of osteoarthritis very streamlined in terms of our physical therapy. The teams put together an education for educating you about osteoarthritis, and then even more, the steps when we finally get to surgery, the plan for surgery, the team in the OR, and everybody. It's kind of a nice big team approach directed at each person's care.
Sure. I should ask you signs and symptoms of knee arthritis.
They're kind of varying from a lot of people, but most of the signs and symptoms of knee arthritis are pain, especially with activity, pain with deep flexion of the knee, so getting from a sitting to a standing position or trying to kneel down or start to become more painful, and sometimes almost downright difficult, sometimes difficult to get off the ground once you're kneeling. People will start to experience swelling in their knees, so the knees will start to swell up, and they didn't have any kind of injury or fall, and so they seem kind of confused. Why is their knee starting to swell up? Pain at night is another big factor. So people start to describe, well, I start to have a lot of pain at night. I have difficulty falling asleep due to my knee pain. All those are varying symptoms that people experience with knee arthritis.
Well, this has been such good information, Dr. Webb, and so important for all of us to hear. Thanks so much for being with us today.
No, I appreciate it. I appreciate the opportunity to sit down and visit and just help educate people about osteoarthritis. It's kind of one of these conditions that's becoming more and more prevalent as we're starting to have more and more people reach that aging population.
Well, it sounds like you have some answers for us, and that's a good thing.
Yes, it is.
And that wraps up this episode of Bryan Health Podcast. Thanks for joining us. For more information or to get connected with one of our providers, head over to our website at bryanhealth.org. Please remember to subscribe, rate, and review this podcast and all the other Bryan Health podcasts. I'm Deborah Howe. Thanks for listening, and have yourself a terrific day.